So, as with Shannon, advocating for change to the systems, mental health carers are being able to have some of that influence more and more through Arafmi and through other mechanisms. There is still a long way to go, as I'm sure everybody in the room would agree. And so hopefully there'll be some ideas today about how the voices, your views, your opinions can actually be heard by the people making decisions. I'm hoping that the Queensland Mental Health Commissioner has some ideas for mental health carers. And so Ivan Frkovic is here to have a chat with you today. And I don't know, what would be your intro song, Ivan? I'm not going to sing it. It's just good to know. It's like a personality test. What would it be? Oh, it's Frank Sinatra. I did it my way. He's still doing it. Here we go.
He wasn't supposed to be from June last year, but anyway. Thank you and good morning, and it's great to be here again. I'd like to also start by acknowledging the traditional owners of the lands that we meet on, the Turrbal and Yagara people, and pay my respect to elders past, present and emerging. Can I also particularly acknowledge Irene Cleland for the great work that she does in terms of representing the carer's voice and view in various forums, and we can talk about the different mechanisms, but I think some of the things I'll talk about are as a result of the work that people like Irene and Arafmi have done in terms of providing additional supports and services both to people living with mental health and drug and alcohol problems, but also to families and carers in that, and families and carers having a voice in that process. So thank you, Irene, and the staff of Arafmi for putting this on. Arafmi has been supporting carers and families and kin since the mid-70s. So we're here for a long haul, and you can see the development that's occurred. So thank you to the organisation, but also it's great to see just the evolution that's happened over this time. So fantastic. Shannon, thank you for sharing your journey. It's always great to hear from people who are living these issues and managing life and moving on and building hope in others, etc. Critical. Can I also acknowledge Karina Armstrong? I think she's here, Executive Officer of the Mental Health Carers Australia. I know that Amy McMahon, the local federal MP, was going to join us. I'm not sure that she's here yet, but she may join us soon. Can also acknowledge Sandra Eyre, who's here from Queensland Health, Mental Health, Drug and Alcohol Branch. The Arafmi board, and thank you for the work that you do, and I know there's a few board members here, but I'd also like to acknowledge, when I'm talking about the board, the passing of Elsa Whitehead, who passed away earlier this year, and just like to thank her for that long-serving commitment to both the organisation but also to people with mental health problems and families and carers. And that's why we at the Queensland Mental Health Commission awarded her the Queensland Mental Health Commission Lifetime Achievement Award. And it's great to always remember the people whose shoulders we stand on, and we continue to build on the work that they've done to provide better support to families and carers. Can I also, just as I finish, just acknowledge who's here with us in the room is also Professor Robert Bland, who is part of the Arafmi board, but I think has stepped down. Robert's doing an important piece of work for us in Queensland at the moment. He's doing an investigation and a review into the services received by people who were either residents or inpatients at Wolston Park Hospital between 1950 and 1990, so the end of 1990, nearly 2000. And it will include also engaging with people both with lived experience of that period and the services they received at the park, but also families and carers will be involved. So please, if you can, just let people know that this investigation is going, and we'd like to ensure that people have an opportunity to express their views and their voice in this truth-telling but also healing process that has been undertaken and supported by government in this process. So Robert's here, but please seek that out and make sure that people know that this is an opportunity for them. Thank you. Having said all that, again, as I think Irene sort of touched on, we can see that moving from Mental Health Week to Carers Week, we are really trying to both raise awareness around the importance of mental health, but also the importance of the role that carers play. We're also trying to do our best to educate the community about the importance of mental health, both for us as carers, but also for people living with mental health problems. And it's also great to see the momentum building around this. I can tell you that when I first started in this sort of space, which was some years ago, we were really struggling to get the activities in the community to actually occur. Now, any activity that's put on, for example, some of the more signature ones, attract thousands of people. The art exhibition in Brisbane City Hall, the Walk for Awareness, the Mental Health Week Awards, Carers Forum here today. These things have built up over the years, so you can see the level of engagement by the broader community in mental health at the moment. So I think, as I think Irene said, we're on the road, lots of good things are happening, but we've still got a long way to go. Having said all that, I think it's important that I want to share with you that things are moving. And I think carers have played an incredible role. So all these things I'll talk about are really as a result of a whole range of inputs, but really families and carers played an important role. And some of this from a Queensland perspective, just a parliamentary inquiry, and the unprecedented investment of $2 billion. Now I'm saying $2 billion, which we've never seen into mental health, including support for carers, is unprecedented. But carers played an important role. Irene, the organisation, your voices through Arafmi and various other organisations influenced what occurred in that particular process. The result, which was the report, but also then the government commitment to $2 billion to be able to take some of those recommendations forward. On top of that, there's been a whole range of national things happening, in particularly the review of the NDIS, which I think will also better support carers, but also provide different opportunities for people living with mental health problems who have psychosocial needs. I think they're the bits that are really important. I'll just talk a bit about those. But specifically, everything I talk about, carers, families and kin have played an important part. And I'll just touch on these things just to be able to share with you, and I think we need to do more work to ensure that people are aware of some of the nuts and bolts of what's actually occurring. But with NDIS, the important move is around ensuring that people have access early rather than at that sort of more severe end. So there'll be an early intervention component, still working through the details of that, so people will be able to get in, hopefully smoother, easier, but also get some level of support fairly quickly as part of early intervention. A major shift in the NDIS process, and I could talk about that a lot, but clearly, there's going to be, at the moment, there's about 90,000 people in the scheme with psychosocial disability, as they call it, which is great, and Queensland has our 20% of that, so we are tracking quite well. In terms of broadly people outside of the NDIS, and I think maybe Sandra may talk about this, but it's really about there is a huge gap in psychosocial support in Australia. So people that don't get an NDIS package, because a lot of jurisdictions cashed out, and Queensland was one of those that didn't, thank God for that. We didn't cash out all of our money into the NDIS, we kept 50% of it. But having said that, our bucket wasn't large anyway. So we need to look at what type of psychosocial support we can put into place for particularly individuals, but that will certainly assist carers in their role in terms of what they're doing. So we have a huge gap, and I'm sure that Sandra can talk to you about the numbers, and they're scary numbers in terms of how many people do still need psychosocial support in Queensland, just Queensland. And so I think that's a piece of work that we collectively have got to move forward on to ensure that investment is made in the right direction to actually start to plug that gap. The gap is huge. The gap is huge. With the $2 billion investment, you're probably going to see a whole range of investments. And I know some money has gone to the non-government sector, including Arafmi, etc. But the bulk of it has gone into investment into public mental health services. And look, when you think about that whole investment, it's important because the pressure on our public system is huge. You trying to get your loved ones into a service can be really challenging. can be really difficult. And that's just because the services aren't there, the pressure on the system, et cetera, the level of acuity that people are presenting with. I can talk, on a number of levels about why that's occurring. We see the prevalence of mental illness across Australia very much the same. It hasn't really changed. It's still 1 in 5 in any year and 1 in 2 nearly in a lifetime. But what has changed, we've seen a doubling of the prevalence with people, young people, 16 to 24 with mental health problems. Mental health, the prevalence of mental health issues amongst young people is definitely on the increase. So we've got to think about how do we support families and carers, but also those young people to get into services. So having a lot of that money going into services is great. But what was also really important, and I think something that I wanted to talk to you about here, part of that state funding was also utilised to attract Commonwealth funding in a bilateral agreement. And now we're seeing these community mental health centres being established. So that missing middle, so you've got the public system here at the severe end, and you've got primary healthcare with GPs and private psychologists, social workers here. But the largest group is the missing middle that's not complex enough to get into public health, too complex for the primary healthcare system. We're seeing the rollout of these, they were called head-to-health centres, now they're called Medicare mental health centres, but we're seeing that middle bit now being picked up through these walk-in, open, it is available online, it is available on the internet, but it is about a walk-in service where there should be no exclusion criteria. Because families and carers and people with experience tell me all the time, all of our services are built on exclusion criteria. Everybody assesses me how they can exclude me. I don't fit their program, I don't fit their funding, their guidelines, whatever it is. We want a service where it's an open door, one door, where people can come in without being assessed on that criteria. So I think that's what we're trying to build there, and it's great to see the Commonwealth and the state putting funds together, and we'd certainly like to see more of that happening, for at least from what I hear from families and carers and people with lived experience. That's what we need to build, that system, because that will take pressure off the public system if we do that right. But we've got to integrate the public system and the private system and the NGO support within those head-to-health or whatever they're called now. I think that's the key to the future, because so people don't fall through the gaps. There's a whole range of other work that's come out as a result of that. You've got mainly the treatment services, which are coming out of NGOs, NGO support through the Better Care Together plan, but then there was a whole range of other money that went for things that are non-treatment related. For example, just minimal investment, and I have to say I could talk for hours about this, into housing and employment. That was minimal investment. But I think one of the key issues that I hear from you and everybody is around supportive housing. The lack of supportive housing for people, which helps carers and families and has a huge impact on people living with actually mental illness. It would be wonderful, and I'm not playing any political game here, I don't care who it is, to really have a strong commitment to supportive housing. That is going to take the pressure of the public system, produce better lives for people, help carers and families. We've got to get the system moving around supportive housing. I think that's one area that we've got to do in the next 3 to 5 years to get that up and running in a serious and concerted way. Other things that I just wanted to basically share with you, we're taking a much more harm minimisation approach in the alcohol and other drugs area, and I won't talk because I could talk for hours about that, but we're taking a broadly harm minimisation approach. And if you just think about the diversion initiative that's being run at the moment, people who get caught for small quantities, your loved ones, my loved ones, other people who get caught for small quantities for personal use are not criminals. They have a problem, a health problem, an addiction. Let's get them into some health and support services and let the police do their work when it comes to manufacturers, suppliers and traffickers. We've got to protect these young people, because if they get a criminal record, their whole life is ruined, and it has major impacts, and I hear from carers every day around some of that stuff. So you can see how we're trying to shift the system around, harm minimisation, rather than actually, taking a criminal justice approach to some of these things. That's going to change, I think, the game in Queensland. The other bits that I think are important for you, and thank you for your input. Stigma was mentioned, and I think Shannon mentioned it. we're doing a piece of work on behalf of government around reducing stigma. I particularly hear the level of stigma experienced by families and carers who have a loved one who has alcohol and other drugs problem is probably even greater to some degree than people living with mental illness or families and carers. And so I think we've got to think about how do we tackle stigma more broadly. And look, we're making some headway, but I think there's more work to be done about making sure that people who are living with, whether it's mental health, drug and alcohol, or suicidal ideation, have an opportunity to feel comfortable to reach out for supports and services that are there. We're doing some work around that. Families and carers are critical in this because the stigma that you experience is probably, at times, particularly in the sort of alcohol and other drug sector, is probably even greater than what we see in mental health. So we'd certainly like to keep you involved, and I know Irene is involved, etc. Keep families and carers involved in helping us to develop a stigma strategy, a stigma reduction strategy. Well, we've also done some work around trauma, and thank you for everybody that's had input. I know there's lots of people here from the family and care and kin sort of backgrounds who had lots of input. And can I tell you, a lot of the genesis of the problems that our loved ones experience, or even that we experience as families and carers, starts with trauma. Starts with trauma. And I think we've got to get the whole system, it's not just health, it's corrections, it's police, it's education, it's housing, it's child safety, it's youth justice. We all got to be on the same page about helping people deal with their trauma. Because helping people deal with their trauma will help them regain control of their life. And I think that's a critical aspect. We're in the now, which just been approved by government. We're in the implementation phase, and we're certainly looking for carers and others to be involved in the implementation process. Because as you know, the best intentions, even when you've got policy and funding, implementation is difficult. Implementation is difficult, and we need the support. Because if there is a failure, and one that we've got to keep an eye on, is implementation. Intentions are right, but eventually it doesn't get implemented. And can I then just say briefly, we're doing some work around engaging better with people with lived experience, including families, carers and kin. We're developing a charter, a commission charter at the moment. It may be called something else at the end, but we're thinking about how do we do better as a commission to ensure that we engage better with people with lived experience, including families, carers, etc. We want to make sure that we're doing the best that we can to ensure that your voice is at the table, informing policy, informing funding, informing, service delivery. We want to make sure that carers are driving some of this. So we are making a commitment through a charter, which will be available at our leading Reform Summit in November, that gives you a clear idea and insight into how to engage with the Commission and what to expect from the Commission when you engage with us. And look, can I also just say, as I finish, we've also given a small amount of money. We're not a funder, but we saw the value of actually building up Arafmi to be the peak for carers in Queensland. It wasn't a lot of money. We're not a funder, as I said, but we saw the value of building not just Arafmi, but the voices of carers, families, the voices of people living with drug and alcohol problems, the voices of people in the space of suicide prevention, but also the voices in the peer workforce space. We've tried to build those types of voices to be at the table in a greater way. With all that, and I could talk for hours, as my kids say, I can talk on the water when it comes to mental health. I just wanted to share that with you, that things are happening, that you are playing a role, and all of these things in some way have got you in mind to try and also support you directly, but also indirectly by supporting your loved ones better through various options and services. That should also ease the burden on yourselves in terms of your caring role. Again, thank you to Arafmi for putting on this particular forum. I don't think I've missed one, Irene, since we started. We started these forums a couple of years before I came into the Commission, and I don't think I've missed one yet. And it's a pleasure to be here, and thank you for the work that you do. Thank you for the many hours of support that you provide, which I think sums it up for me very nicely, what a carer said to me, and I'll never forget this. She said to me, and I think I was in Cairns, she said to me, "We are your first line of defence. We are your first line of service delivery. What is the system doing to help us?" And I think you can be assured that as best as I can and the Commission, but also organisations such as Arafmi, where you belong, and others are doing everything we can to ensure that you get the support that you need. Thank you.